So there are a lot of factors which play, which among them is our lifestyle is contributing to that. So we need more activities in the school where there could be a playground. Earlier, nowadays, when we were children, our parents used to call us inside, hey, it's 6 o'clock, come inside and start reading. But nowadays it's not like that. I need to push my children out, you go and play for some time. It's the reverse. So they're all addicted to phones, laptops, TVs, everything. So I think all these are factors which are playing in addition to our genetic factors.
I think we heard Dr. Ravi loud and clear. Activity, no addictions, and no fast food. That's the way to prevent lifestyle diseases. And I mean, as you mentioned as well, there are genetic factors which come into play. So now moving on to our next question. Fast food, energy drinks, and ultra-processed foods along the same lines are widely consumed by teenagers. Should governments impose stricter regulations on these specific products? And this question is directed to Dr. Lalita.
For control of these things, for us we have a lot of distractions. I always say we were in better placed in our era. For youngsters like you, and I have a daughter also, we were only focused on studies. We had exercise, playing, and all those things. And TV was something which came in 80s, okay. But now your TV screen is with you itself, and your information is loaded at your tips of your thing. So I feel the challenge for our student, the younger generation, is much more than what it was. For us, it's only focus on studies or be focused with our parents. But now, if the student is performing well, he's doing beyond these addictions and coming out. And I think I should appreciate children who are performing beyond this, because they are detaching themselves from this screen time and performing well. Having said that, this government is aware of it, and there are restrictions. In fact, there are taxes levied on certain sweeteners and all those things. There is a lot of regulations for even looking at the products which are not really good for our health, okay, in terms of even the preservatives and additives, all those things which are contributing. And however, what's happening parallelly, we have attractions towards it. The advertisement industry is big, and the way they invest onto the advertisement, I think all over your fans are the ones who are promoting such things. And I feel they should have moral responsibility to see such, they do not contribute to this kind of advertisement. But nevertheless, these attract very fast. And moreover, all this, unfortunately, all these foods are more tastier compared to your homemade, mama-made foods, right? Always they want snacks or something which is attracted, and the packaging, all those things are coming in a big way for us to distract. So what is important for us is the government will do, that is the legislative part, the government is doing it. But beyond that, there is the industry which is going to survive, which is going to be there. And I think beyond that, it is our willpower, our understanding, and that's where school plays a very important role, educating these children, and children taking initiatives to be aware of certain things and start developing habits and try to take. It's okay to have it once in a while of any of these things, but not make it as a daily habit, because slowly these are going to accumulate in your body itself and really be harmful for us itself.
Great answer by Dr. Lalita, and I think we as the children, as the future, we should look after our healthcare and look after everyone around us. But the first place we can start is looking after our own healthcare, as pointed out by Dr. Lalita. So my next question is, physical education is often deprioritized in schools. Should structured exercise be made a mandatory part of the academic curriculum? And this question is directed to Dr. Lalita again.
I think the schools have started that, and it's a great thing. But again, the students have to be pushed. I don't know what's happening in this school. I hope the students are encouraged, and you are given importance to co-curricular activities and extracurricular activities, because it's not just about curriculum. We need to be completely development, and I think it is there. To what extent it is being pushed is even, in fact, some of the schools have developed yoga also to promote our both physical and mental health. Now we say health is just not physical, it is mental, spiritual and social health also. Social health is something which we are also looking at, which is affected. We do not talk to our own next person who is next to them. We talk with the mobile, right? So getting up and going and working is very important, and it is proven beyond doubt all the any physical activity is going to definitely delay our onset of non-communicable diseases. The risk factors are there because the environment is full of risk factors. If we are, some of which is non-modifiable. Our age, as we age, we are prone for things. Our genetic factors, hereditary factors, those are not going to change. But what can change is our healthy lifestyles, especially the physical activity and our diet and stress management. All these three are equally important, and physical activity will definitely also will take care of your not only physical health, also mental health, and it has to be compulsorily done, and I think schools are doing it, and the motivation has to come from school children also. They can take the clue from again the screens and start doing things. I think there are a lot of gadgets which are motivating them. Use them in a positive way. We can't say stop away with your, do away with your mobiles, do away with all your gadgets. It is going to stay with us, but how you use it, it's left to us, right? So we must effectively utilize for our own good health.
Thanks a lot, Dr. Lalita. And I think our school does play a huge role for encouraging us in extracurriculars as well as physical education. So I think that's a really great part of being a part of TISB's community. So that's one aspect which is looked after, I think, by our school. So we're going to be moving on to the final section, which is mental health of teenagers. And now, my first question is to Dr. Aditya. My question is that recent studies suggest a strong connection between sleep deprivation and teenage mental health issues. Should schools adjust their schedules based on neuroscience research?
It's a great question. Yes. Yes is the answer. But can schools do it? The schools are under so much pressure, including from the parents who go to their work at conventional times that were not based on neuroscience, but actually based on workplace rules. So perhaps society needs to change. I think we're still trying to understand the role of sleep in mental health. We understand a lot of it, but there's a lot we don't understand, which is productivity. And are there different people who sleep at different times? What's the role of a nap? Should we be having couches at work where we can have a nap? Should we be asking children to spend 8 hours in school and be attentive? And if so, are we going to change school curricula so that it becomes more interesting and you don't have to sit in a seat and pay attention to somebody talking like this? These are very good questions, but I don't have all the answers. Should schools change? Yes, 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 yes. But how they change, I think will take time. I'm hoping some of you will get into sleep research, which says, actually maybe getting a child in a school between 8 a.m. and 4 p.m. is not the most healthy way to actually get the best out of them. Maybe sometimes schools will have to break up for different things. I went to a very small school, completely unlike this, where we would turn up to school and for a couple of years, we would decide what we would study on the day. And it was 100 acres and we would walk around, we were all in the my memory of school is fun. And I'm hoping that in modern education that will include sleep times, that will be also part of what happens. But yes to the answer of should schools change to mirror new sleep research? Yes, but carefully and with studies attached to it.
Just have a thing to add to that also. It's not entirely the responsibility of school alone. We have to keep in mind, because they are not accountable entirely, and they should not be given the full responsibility to take care of the sleep pattern of teenagers. What we also have to keep in mind is it's not only the school timing which is going to influence their sleep timing, it is also the fact that they get into other things. You have your studies post-school, you have your play post-school, you got your visits post-school, you got your travel post-school, and then you still on your whatever and you want to use it a little later into the night. None of this is it. a minimum of 6 hours of good sleep to those women. We are talking about good sleep. We have people are awake at 4 o'clock, 2 o'clock in the night and getting up at 6 o'clock in the morning. And then say I went to the gym and had a good exercise. Where's the sleep? So something called as sleep deprivation syndrome. And it's a big thing. I mean, it's studied, it's been studied a lot, and it's lot of research is there on that. And it's affecting not just mentally, but the physical health as well. And you don't get to know about it until it's affected you. And you approach a person, you approach a specialist only when it's already affected you. The very fact that you've met a specialist means you're affected by it, as of now. So the preventive aspects is you make sure that you stick to the basics. And the basics is 8-8-8. 8 hours of proper decent work pattern or study pattern. 8 hours of sleep. Yes, we can't get 8 hours entirely, but at least 6 to 8 hours. And the remaining 8 hours is time for yourself, time for your family, time for your friends, little bit of time to study and lots of time to play. That's how it should be divided. I mean, this has to be managed. So school plays a big role in it in trying to teach this, also adjusting their schedule. But it's not entirely their responsibility alone.
I think a great answer by Dr. Aditya and a great addition by Dr. Darshan. I think this is a very relevant problem and very relevant question, which is a great question for this generation and specifically all of the high school stressed teenagers. And I think it has been a great answer from them as well. It is a collective responsibility. It can't just be taken by the school or by one specific institution per se. As Dr. Darshan and both Dr. Aditya mentioned, it's a collective responsibility and we don't know how we'll get to this change, but it's something we do know we have to change. Alright, so that concludes our questions and our panel session.
Okay, so now we'll be opening up question and answers for all of you to ask them. We have people with microphones going around, so can we have can everyone who has a question just raise your hands, please? Can we have one person over there?
Hello, my name is Ishita. I'm in grade 10. And my question for all of you is, how can we as students get involved in the medical community? Is it useful for us to read medical journals or partake in research projects? What are the different ways we can just be more mindful and aware of the things happening in the medical community? Thank you.
I think that's better way of spending time and then, understanding your body. You need to know your body as long as you live. So instead of playing a game on the mobile, I think this would help you. And also, who knows, it might give you certain ideas and then create something new in the medicine, contribute to the society as well.
I think apart from that, you've already taken the first step by attending this program. So that's the first thing that you've done. Which that itself is a good thing. The very fact it's being conducted here, the people are participating, we need to congratulate you for that. You're not part of the empty seats. So you are being a part of it, we need to congratulate you on that. You've taken a step towards it. And how to be a part of the program? The next thing that's going to happen after the panel discussion, the training for the resuscitation. That's the most important and basic thing that is required, basic life support thing, which anybody, teenager and adult, young adult, these people should be trained because they're probably much better than the older adults to give it, to be honest and to be practical. They're probably much better if they get trained properly. So, to be a very, very big and active role in research and all that, probably a little more time. Not at, for example, in grade 10, not at this time probably. Being aware of it in grade 10 is fine, but to be totally a part of it, probably a little more time. You get a better understanding of it, and then you can probably play a much better role, both as a volunteer and as a participant.
Okay, thank you so much. What about medical mobile games? Does that count? No?
Definitely, I mean, you should never say no to all these things. It's not a no to anything, but it's only about how much we use and how frequently, how long. It's all the balance of that. It's not like you start with it and then go for the next 2 hours.
Yeah,
Not,
absolutely.
Not.
Yeah, balance is the thing. Yeah.
Sorry, so I'm just going to answer from my field. In mental health, there are 3 things you can do in Bangalore. The first one is in our service, we are now offering internships to school children who are at the end of their school, the 11th and 12th. So some courses require internships in mental health services, so you can come and watch the work we do. Number 2, we're setting up school programs for distress management and suicide prevention. So if your school wants to participate, that's something we could do with you. So you can learn how to become a school peer counselor. Those are things you can do. Number 3, there's a very big program in Nimhans that is run every year called the Sante. We see a lot of schools, so when I do programs over there, we're getting increasing school engagement. So if you want to put up a stall there and then you do a program of mental health with your school, maybe contact Nimhans, the public health education department, and see if you want to do this next year. So lots of things you can do.
Thanks a lot, Doctor, for that insight. Now we'll be moving on
Just
to
a
the
minute,
next
Varishma. I will just add on. As you are interested, you can take up small research, and especially preventive medicine as a public health, you can take up a lot of issues. Like for example, just creating awareness of helmet usage. Simple topics like that, or use of junk foods among the students. Take that opportunity, look at how much the students are doing or the public, and you can educate and look at. You can bring in small research. You can tie up with small organizations, NGOs, or medical schools if they permit, and do small type of research which will interest you also.
And another very important thing to add to that is substance abuse. That's a very big thing, especially among the teenagers. So if you want to be actively involved in that aspect, taking care of the health issues or the mental or the physical health issues of the teenagers, your own colleagues and peers, substance abuse is something which needs to be looked into in a little more into detail and more finer. So you can probably be a part of it, like Dr. Aditya said, be a part of the group who deals with these things, who understands these things, help out your friends that way.
Okay. Thank you so much. Can we have a question over there?
Also, just a short mention before the next question is asked. We did have an anti-vaping awareness week last week itself at our school. So I think it's a great topic which TISB is taking like first steps towards like sort of addressing. And I think that's a great thing, and all schools should do that. And I think it's a great way to encounter this specific topic, which has a lot of stigma surrounding it. Yeah, thanks a lot to all the doctors in the entire panel for giving insights on that question. Next question, please.
Hi, I'm Anika. I'm from grade 6, and I have 2 questions. So one of them is to Dr. Aditya, and one of them isn't really to any one of you. It's like open. So my first question is to Dr. Aditya. Earlier you said that you're fine by bots like taking over jobs for therapy, like not really taking over, and like you're happy to know that some jobs might be taken by bots like therapy. So I'm saying, don't you think that people might not be very comfortable or fine by like talking to bots? Do you not think they might feel a bit ridiculous, like?
Without knowing that you're already talking to your phone, you have a deep and meaningful relationship with your phone. You are closer to your phone than to anyone else. And I warn you now that your AI engine in your phone knows you better than most people. These are scary things. We could live in a world that's bubble that says, no, we're using technology isn't using us. But I think you will find that the balance is changing. So this idea of, are you more comfortable with your phone? Most of you are actually more comfortable with your phone than with other human beings. I see 6 of you together, 5 of you will be on your phone. And you might be communicating with each other through that phone. So you already have platforms through which, we're not saying you're communicating with your phone, but we're trying to get answers to questions that upset you. So what we're realizing in mental health, for example, is that traditional systems don't work. So if, for example, you're feeling really distressed, it may not be during my working hours. You might be distressed now, but you can't choose to come and see me in 6 weeks, which is my first appointment, saying I'll go see that guy in 6 weeks. You might want help now. And we might need to have a system through our hospital, through me, through whatever else. It says, temporarily we also have this system, try and see if you can solve your problems through this. So for example, if I don't know how to fix something in my car, I will Google it. I will look at a YouTube video that says, here's how you change the fuse on your car if you still need to go. So there are some running repairs that can be done through information that you get through your phone. That's the kind of stuff we're saying. We're not saying we're going to replace all human beings, but I'm stating facts. that actually the box, the engines that you have, may learn to be better communicators, may understand a little more about you than the average entry-level therapist that you go and pay for, who doesn't know you from Adam, and actually is running through a script in their brain, badly, because they're humans. So I don't want you to be scared, and also I don't want you to worry about the jobs. The jobs will look after themselves.
Yeah, thank you. That's a really nice answer. My second question is to any one of you really. So after all the studies that, imagine you want to be a surgeon, after all of the studies that you have to like first take a basic job? Excuse me. Do you first have to take a basic job as like a clinician and like slowly work there for a few years and eventually get to a surgeon? Or do you get to become a surgeon as a group?
Basically, you'll have to do a basic degree called MBBS. After that, that is the introduction course to medicine, kind of. After that, you decide to become a physician, surgeon, whatever. Then, if you want to just to be a cardiologist like him, just go to the one more degree of heart specialist, urology, kidney, lungs, liver, like that. It all depends on how far you have to go, number one. Number two, as I said, medical course is training people. Once you are a surgeon, if you feel you're skilled enough, you can straight away start your practice if you're confident. If you feel if you're not skilled enough, if you feel if you're not completely confident, then you'll have to go work under somebody who's good and who's successful.
Thank you.
I think we're going to take one last question to wrap this up quickly before our break, since we see that we're running short of time. Logistics members, just pass it to one last person.
My question was, what is the role of communication in the treatment of a patient?
Communication is very important. I'll tell you, we say doctor treats but God heals, that is the statement. And communication is one of the very important things, that's what I was telling you. That's one of the skills we were lacking and we are now brought in curriculum as well, right? So simple example, let me quote example. Patient is dead. If you have to communicate to the family, you just can't go say your mother or father is dead. How you communicate matters, how the person will take it, right? Just imagine someone is telling me that one of your patient admitted is died. The way you tell matters to me, how I take and internalize. Because we are dealing with life and death. So it is very important at all steps, not just I'm talking the most severe form, that is the death. Even just telling, for example, simple headache, you can give medicine and send them. Until unless you do not know what is the cause of the person, there is no point in keep repeating giving the medicines. Probably there is some stress factor which is there, without which I am not getting the information. I have been treating with medications, it won't. So doctor-patient relationship is something very sacred one, and it is something which is talked of these days. It all is based on our communication, trust and empathy what we have. I think in communication, I think it's one of the foundation which we need to have as a doctor. Anything you want to answer?
You have to talk to a patient by calling, I don't know your name, Mr. Ramu or something. I start off my day, Mr. Ramu, how are you? Or the other way, it makes difference, right? So it's an art. Communication is an art. What the patient talks to you, how you behave with him. The relationship stays longer with you and your doctor, the way he communicates. So it's very, very important. It's part of our curriculum now. This art of communication, art of ethics, attitude. So we have to have that communication skill with the patient, with the patient's relative.
Alright, I think you would have seen Dr. House series, some of you. He is a very good treating physician. His communication is need to. We in fact give that examples. How the same situation, how we can communicate better. Right? You all see many times, you go to a doctor whom you are more comfortable, whom you can communicate, with whom you can relate to them and you can open up, because you have so many things to tell. It is not just that disease is present or not absent. There are so many factors which are operating for our disease to manifest. Thank you.
And part of the treatment which is there is what is called as reassurance. It It is there in how to take care of the patient. It's not just by giving medicines, not just by telling this therapy and that treatment and all that. Reassurance is something which is actually listed in the way we manage a patient. And how do you get reassurance from Google? How do you get reassurance from somebody who's talking to you over the phone? That is not going to happen. The one who is having a knowledge about it is the one who can probably, and the experience about it, is the one who can give you a reassurance, which is part of the total treatment program.
Thanks a lot to all the doctors for their insights. And yes, as Dr. Lalita mentioned, I think a lot of us are interested in medicine, so many of us must have watched the show Dr. House. It was also used in our trailer for Medcon. In fact, it's a really educational show more than just medical, and it's also fun. It's a great show to watch. So we're going to be concluding our Q&A session, seeing as we're running over time and we need to have our break as well. One thing we will do is I want you all to write your questions in the notepad which has been given to everyone with a pen, and just pass it on to one of the logistics members, and then we'll be answering these questions later on. I'll be sending a message to the doctors, and hopefully we're going to coordinate how to get you guys this answer, because I don't want you guys to leave disappointed or disheartened. Yes, so now one last announcement to the doctors. Thanks a lot for joining us today. It was a great experience listening from all of you, and I think they deserve a huge round of applause one last time from everyone over here.
Okay, so now we're going to have a short refreshment break. For all of the students, go right outside of the auditorium, and under the shed there will be refreshments provided. And for all of you esteemed doctors, as you're leaving.
Thank you very much. I would say doctor profession is still a very noble profession. Those who want to pursue it, please go ahead, but do it with passion and out of your own interest, not because your parents told or not because somebody told you. If it is out of your passion, you want to serve the society, it is definitely a good profession. Money will follow afterwards, don't worry on that. There are a lot of other career options. But if you want to do it, please go ahead. It is a bit taxing, demanding, all said and done. It's still a noble profession, and no profession can replace that because you're dealing with human and life.
And there's a lot of ethics and morals.
Okay, so that's a message for everyone. Do everything you can with passion. Do every single thing you do with passion, because that's only when you will reap your profits. So we will disperse for break.
So there'll be break, refreshments under the shed, as Rennie mentioned, for all of the participants. And for the panelists, just one last request for the panelists. The photographer over here wants to take individual pictures of you all before you leave. And there are refreshments right in front of the main audience, like just outside the gate for all of you, our esteemed panelists.